Greetings, this is Dr. Sandra Cabot. Welcome to my video on acne and how to get it under control, thank goodness. In my 2 videos on acne, you will learn about a holistic approach to controlling acne, which addresses all the causes. We will discuss hormone treatment, medications, the best supplements, and topical treatments. Acne may vary from mild to severe, and all possible treatments are sometimes needed to get it under control. This video will enlighten you, as I have done extensive research and I have helped hundreds of patients with acne. Acne often causes enormous stress and poor self-esteem and can be disastrous for young people in the prime of their lives. Acne vulgaris is a common skin disease associated with blockage and inflammation of the sebaceous glands. The sebaceous glands are tiny glands attached to hair follicles. Sebaceous glands secrete an oily substance called sebum to moisturize the skin. Sebaceous glands exist alongside a hair follicle with an outlet emptying into the canal. Inflammation and infection of the sebaceous glands causes pimples, which are referred to as comedones. These are pinkish-coloured small bumps, also known as papules, found on the skin of those with acne. Acne lesions occur mostly on the face, but can also affect the back and front of the chest. So let's look at the causes of acne. Hormonal imbalance. High levels of androgens, or male hormones, can cause acne because they increase the size of the sebaceous glands and promote the secretion of more sebum. This is what occurs during puberty in males and females when the production of androgens increases. Women with Polycystic Ovarian syndrome, abbreviated to PCOS, usually produce excessive amounts of androgens and thus are prone to acne. Women with Polycystic Ovarian syndrome usually do not have regular menstrual cycles and may struggle with excess weight and facial hair, as well as acne. Being overweight or eating a high carbohydrate diet can increase levels of androgens in the body. There is a protein made by the liver called sex hormone binding globulin, abbreviated to SHBG, which binds androgen hormones and thus makes androgens less active. When they are bound up, androgens do not affect the sebaceous gland so much. Sex hormone binding globulin binds all the sex hormones, making them less available to cells. If levels of sex hormone binding globulin are too low, the levels of free active androgen hormones increase, and this aggravates acne. Low levels of sex hormone binding globulin can be caused by fatty liver, high insulin levels, and a high sugar diet. It is good to have higher levels of sex hormone binding globulin, and this can be achieved with regular exercise, weight loss if overweight, and surprisingly drinking caffeinated coffee. Now, I don't recommend you overdose on coffee, but if you enjoy it, then this is fortunate. People who take testosterone treatment for bodybuilding or low libido can find that they develop acne because their blood levels of testosterone rise. Blood tests can be done to check your levels of androgens and other sex hormones, and also your levels of sex hormone binding globulin. If your levels of androgens are too high and your level of sex hormone binding globulin is too low, this could mean your acne is caused by a hormonal imbalance. Thankfully, this can be treated very effectively. Another cause of acne is infection. Acne is associated with the presence of a skin bacteria called Propionibacterium acnes, which lives off or eats the oily sebum secreted by the sebaceous gland. This bacterium becomes more active under the influence of the higher levels of androgens. Propionibacterium acnes bacteria causes the pus and inflammation in the acne lesions. Blocked or clogged sebaceous glands are known as blocked pores, which can cause blackheads and whiteheads with pus. Another cause of acne is incorrect diet. Now, some people think that diet has very little to do with acne. However, our diet affects our hormone levels and the bacteria in our gut and on our skin. Bacteria love sugar, so the Propionibacterium thrives on a high sugar diet. So saying that diet has no effect on acne does not make sense. A high carbohydrate diet and or being overweight increases the production of the hormone insulin. Insulin increases the production of androgen hormones by the body, which worsens the acne. Your diet can have a huge effect on acne, and we will go over the best diet to reduce acne in this video. Let's look at good foods to reduce acne. These include garlic, onions, all fruits, especially pineapple and citrus fruits, all vegetables, especially cruciferous vegetables, kelp and seaweeds, fresh meat, not delicatessen meats, poultry, eggs, seafood, nuts, seeds, coconut, avocado and raw vegetable juices. What about dairy products? Some acne sufferers find that avoiding dairy products, especially cow's milk, cream and ice cream, improves acne a lot. This is not surprising because dairy can increase sebum production and contains growth-promoting hormones. So you may want to go on a dairy-free diet for 3 to 4 months and see if it improves your acne. Another thing that can cause and aggravate acne is nutritional deficiencies. Nutritional deficiencies of vitamin C, vitamin A, and the minerals zinc, iodine, and selenium make it harder for your immune system to fight the infection in acne lesions. These deficiencies reduce healing so that scarring may be more likely. Let's look at the treatment of acne. Start with the best diet for acne. The best diet to lower insulin and thus testosterone is a healthy ketogenic style diet. You can download my free ebook on the ketogenic diet on liverdoctor.com website. If you are not overweight, you do not have to be as strict with carbohydrates, and you can enjoy starchy vegetables as well as green vegetables. Healthy protein and fats will not elevate insulin or testosterone, so you can have meat, poultry, eggs, and seafood. Good fats include oily fish, nuts and seeds, avocado, coconut cream and coconut oil, olive oil and tahini. Just because sebum is oily does not mean you need a low-fat diet. Healthy fats do not increase oil production or sebum production in your skin. It is carbohydrates that increase insulin, testosterone, and sebum production, not fats. It is proven that intermittent fasting causes beneficial changes in the gut microbiome and thus the skin microbiome. The type of food you eat causes profound changes in your total body microbiome, including your skin. During fasting, short-chain fatty acids increase from breaking down fibre, and this leads to less acne-causing bacteria on the face. The best source of fibre is vegetables. It is important to increase your intake of vitamin C as it reduces infection and inflammation and promotes healing of the acne lesions. Vitamin C is high in citrus fruits, kiwi fruits, passion fruit, capsicums, tomatoes and berries. Sounds delicious to me. To improve your skin microbiome, probiotic foods can help and are found in a wide range of fermented foods. These include plain yogurt, kefir, kombucha, sauerkraut, tempeh, kimchi, and miso. Spending time outdoors not only gives you vitamin D, but also exposes you to millions of microbes, many of which can improve microbiome diversity and thus improve your skin microbiome. So what food should you avoid? Findings from small studies suggest that following a low glycemic diet, in other words a low carbohydrate diet, may reduce the amount of acne you have. This is because foods high in carbohydrates increase levels of testosterone. Foods high in carbohydrates include sugar, bread made from grains, cornflakes, rice, packaged snack foods such as potato chips, corn chips, pretzels, etc., many processed foods, many sauces and dressings, fried chips, donuts or other pastries, desserts, sugary drinks such as milkshakes and soft drinks. A healthy liver is important if you want to overcome acne. The liver makes sex hormone binding globulin, which we know needs to be at adequate levels to bind and inactivate the androgens such as testosterone. The liver breaks down excess hormones, which are then eliminated through the bile. A low carbohydrate diet is healthy for the liver. Well, that doesn't sound too hard. A healthy diet for acne can be quite delicious. Well, that's all for this video, and I thank you for listening, and I look forward to sharing with you more about acne on my next video, where I will discuss hormonal therapies, supplements, and topical treatments. It is great to know that your acne can be fully controlled in a healthy, safe way. If you like this video, you can click subscribe and like and share it with your friends. If you have any more questions, please email us from liverdoctor.com or cabothealth.com.au. We love to get your questions. And thanks for listening.